Hi everyone, my name is Cynthia Garcia and I graduated from the UTRGV PA program in December 2020. I've been asked to answer a couple of questions for you all, so let's go ahead and get started. So the first question is, tell us a little bit about yourself and your PA journey. So prior to entering into the PA program, I practiced as a registered dietitian for several years. I was in the community bariatrics and dialysis settings. So I had my undergraduate degree or Bachelor's of Science in Dietetics, and I had also obtained my master's in public health prior to entering into the program. I probably knew I wanted to become a PA during my undergraduate studies. I had a sister with various medical conditions, and in many occasions she was treated by a PA, and what I found from them was that they were very compassionate, they were empathetic, they're patient, and just very knowledgeable, and I wanted to be able to help patients at that same capacity. As I mentioned previously, I do have my Bachelor's of Science in Dietetics, so one of my passions is preventative care and just overall health and wellness. So I wanted to incorporate my knowledge of preventative care, medical nutrition therapy, and medicine to help patients as best as I could. And currently I feel privileged to be able to say that I'm practicing as a PA. So question number 2 is, what field of medicine are you in and what does your typical day consist of? So I'm in 2 different areas, family medicine and occupational medicine. They're both 40-hour work weeks. 1 week I work family medicine, the following week I'll work occupational medicine. Family medicine is Monday through Saturday and the occupational medicine side is Monday through Friday. My caseload ranges anywhere between 15 to 30 patients. On the family medicine side, I'll see general cases, just to name a few: cystitis, ear infections, patients with COVID-19. Now I have flu cases because it's flu season, and then skin infections. And on the occupational medicine side, I oversee workers' comp cases where it's injuries that have occurred at a patient's workplace. I conduct Department of Transportation physical exams, conduct pre-employment physical exams, as well as take part in reviewing the audiometric results for companies that are taking part in the OSHA Hearing Conservation Program. So at the end of the day, I try my best to complete all of my notes, and then I start looking at the following day just to see what my caseload is going to look like. So the third question is, tell us about an interesting case you have seen. So last year I had an elderly woman come in with a previous history of smoking. She was coming in as a walk-in, and she was coming in mostly because she had a cough for approximately a week. She was looking more for a cough suppressant. Well, when I got to the part of asking her if she had blood with her coughing, she goes on to inform me that she had been noticing some blood on her napkin when she would cough. But she didn't really think too much into it because 20 years prior, she had experienced some throat polyps. So she was experiencing very similar symptoms, and she said, if anything, if they are throat polyps, I'll just have them removed. But since she did mention that she had been experiencing some blood with her coughing, I advised her that it would be a good idea to take a chest x-ray just to make sure that she was safe. And so she went ahead and she agreed with it. So when the results came back about 30 minutes later, I'll never forget that they read something to the effect of multiple lesions observed, most likely malignant. So initially she was my supervising physician's patient. So I didn't want to overstep, and I contacted him and asked if it would be okay if I shared the news with her, and of course he was fine with it. And from there on, I went on to read I went on to read the results. We did a referral to a pulmonologist and then an oncologist. Unfortunately, it was lung cancer. And although it was a very unfortunate event, it's times like that I'm grateful that I was able to help her in some way, even if it was just to find an answer regarding her cough. So the fourth question is, what is the first thing you purchased with your PA income? So I've been fortunate enough, or I was fortunate enough to have a husband that was very loving, supportive, and caring during my time in PA school. And so I'm truly grateful to him because of it. So I had been noticing that he had been eyeing an Xbox One X, but they were never available. So to his luck, they were available when I was about to receive my first check. So that was my first purchase, an Xbox One X for him. Question 5 is, what is the most gratifying thing about your job? So for me, it would be being able to be of service to others, to help others find the answers to their medical conditions. And it's especially gratifying when the end results are positive. And it can be in anything from the mild to severe cases that I see. Question number 6 is, what is the one bit of advice you would give a current PA student? For me, it's going to be, make the most of your time in school. Rest, self-care, but try to gain as much knowledge as you can. Being a PA is a lifelong learning profession, and it'll help immensely to have a good foundation of knowledge when you first start practicing as a PA. In addition, I know that each one of you all in this program is more than capable of being a great PA. I wish you all the best, and I look forward to having you all as colleagues in the future.